Hello everyone, my name is Alex and I'm with Professor Stokes Friday Clinical Brady Brunch, Swati, Brooke, Cassidy, Twee, Chelsea, Zach, Marissa, and Hannah, and we did our EBP over fall reduction interventions. Our facility site was at Windsor Nursing and Rehabilitation Center of Corpus Christi. So we chose our PICO question to be, do fall risk protocols compared to collaborative practice help ensure the safety of nursing home / long-term acute care residents during their stay? Because our facility has a history of falls.
A few discrepancies that we have found to be an issue at our facility site include the presence of a fall risk team, enforcement of fall risk protocol, and not knowing which residents are contraindicated for increased levels of activity. Due to the type of facility our clinical site is, armbands are not utilized because this is not a hospital setting, which would be appropriate for the presence of armbands, such as allergies, fall risk, and so on. As a result of lack of identifiers, we don't know if the resident is at risk for falls or if they are scheduled for PT.
One of the few things that can be done to fix the problem is by having the top bed rails up at all times. However, having all 4 rails is a sign of restraint, causing anxiety and negative feelings for the patients. When top bed rails are not pulled up after the patient is put into bed, it can cause them to roll out of bed if they are trying to move. Patients who are on the heavy side can sometimes be very difficult to transfer and at times need a Hoyer lift or more than 2 people. It is important to implement proper body mechanics when transferring patients to prevent injury to both the nurse and the patient. At times, patients who prefer to be on independent end would like to be able to grasp onto stands while being assisted when moving and transferring. When patients who are used to being independent suddenly become dependent on a healthcare provider, they start to feel inadequate. Incorporating more physical activities will allow patients to be discharged faster and sooner. It also teaches patients exercises that can be done on their own when they are not at PT.
Examples of exercises that can be used are strength and aerobic. Some strength exercises include leg and shoulder press, while aerobic exercises include walking on a treadmill, swimming, and riding a stationary bike. These are associated with decrease in falls according to our research. Strength training in particular has shown a significant reduction in falls
according to the research by 75%. The two types of muscle movements are isotonic and isometric. Isotonic movement enforces the shortening and lengthening of the muscle and builds mass. Isometric is when there are no movements in the muscle and can be used to maintain shape and prevent muscle atrophy in immobile residents.
To maintain shape and prevent muscle atrophy in immobile residents.
So, how can we do at nursing intervention to reduce falls in the facility? First action is to appropriate exercise to improve muscle strength, also the balance and gait. Besides practicing exercise for all residents, preventing syncopes is a significant intervention. Syncope is also called panting or passing out, in which people lose their consciousness and muscle strength. It happens fast onset, short duration, and spontaneous recovery due to the lack of oxygen getting in brain, also known as orthostatic hypotension.
Another way to help prevent syncope is knowing the resident's medication history, medical conditions, and allowing the residents time to sit from the supine position prior to them standing up. The use of proper lighting will also help reduce the risk of falls. A few examples of appropriate lighting include strong lighting without glare, night lights, and well-lit pathways to the toilet. These are all prophylactic measures that can help provide the residents with the best practice for maintaining safety according to our research.
In addition to the previously stated interventions, interdependent interventions such as working alongside PT and OT will help provide the residents with exercises that can be performed outside of their department. A few examples of these exercises include passive and active ROM. According to our research, the best practice showed that having group-based exercise classes provide positive results. A way for these classes to be divided is by the intensity according to the residents' physical capabilities, along with 50 hours of class time being distributed over the course of 25 weeks.
Talk to lack of protocol enforcement. Due to the lack of protocol enforcement within the facility, we typically see a steady occurrence of falls within the population, and this can be attributed to understaffing within the facility. We also see an increase in injuries that could be attributed to more medications in use, which can lead to orthostatic hypertension and such issues, and which lead to more falls. And we also have the inability to thoroughly assess for fall risks that can be attributed to both understaffing and medications, because you have the medication side effects of orthostatic hypertension that can't thoroughly be taught to the patients. And you also have the psychological and social factors, such as the fear of falling and not being able to go out and do activities because of the fear of falling.
As a result of our research, we found that some positive therapeutic outcomes to expect would include improved resident safety, which is crucial to their well-being and legal applications. The increased safety of the residents will help provide the facility staff with a more manageable and efficient manner. They can help provide proper education to the residents about why it is important to perform these techniques and how the following exercises will benefit their health. Decreased fall risks can be achieved by performing evidence-based practice exercises, balance exercises, sitting exercises, and standing exercises. These are all potential results we had found from our research that displayed the best practices.
The way we came about our articles were through academic databases such as Medline and EBSCO. These databases were found on our TAMU-CC library website. The reason why we chose these articles was because they showed the best evidence-based practice for our facility.